Diabetes, which you know a lot of people are living on dialysis as we speak, mental health issues and injuries, amongst others. And in addition, these non-communicable diseases certainly have a crippling economic impact on our country. We've talked severally about the burden that families face, communities face in dealing with diseases such as cancer. And that is why universal health access is a big agenda for the government. And while there are a number of risk factors for non-communicable diseases that can be modified, the Ministry of Health continues to be very, very keen to strengthen our health promotion and educating the public, the community, work people at the workplace, people in schools about how we can deal with this. And the ultimate goal for us is to see behavior change amongst the at-risk population, and indeed all of us. And that is why, and I will speak later, we are putting a lot of emphasis about our behavior as Kenyans as a major effort to averting health challenges. Currently, we are in the 6th wave of COVID-19 pandemic since the first case was reported in March of 2020. We are on the 6th wave. People who are suffering from non-communicable diseases, the ones that I've just talked about, people who are living with cancer, diabetes, high blood pressure, amongst others, are the ones who are at most risk of developing severe COVID-19 as a disease. And so what remains a big challenge for us as a country is that despite the fact that we have sustained supply of vaccines to every part and every corner of this republic, there are still so many Kenyans who are yet to get fully vaccinated. And therefore, it is absolutely necessary that through a multi-sectoral and integrated approach, such as the one we are seeing here today, we ensure that we institute that to address this very concerning low coverage of COVID-19 vaccination in our country, and one that we are experiencing at the moment. And it is on this basis that we have introduced the accelerated COVID-19 vaccination program in order to rally more Kenyans to embrace vaccinations which are already available in most of our facilities. And I'm happy to note that we've done this acceleration launch in several counties now, and we are yet going on. And I want to take this opportunity to reiterate the importance of vaccines. And we will not tire, as a Ministry of Health and as a government, to reiterate that it is important for us to be vaccinated in order to prevent the development of severe COVID-19 disease and its associated deaths. And we know, like my colleague Dr. Gitahi has said, that immunization, vaccination remains the most important strategy for preventing severe illness and death where COVID-19 is concerned. That we should still remember, as a country, we have lost more than 5,000 people. 5,000 lives have been lost because of COVID-19. And this should be a reason why we should all get fully vaccinated and also be motivated to take booster shots. In fact, I am sad to note to you that yesterday we lost one Kenyan to COVID-19 vaccine. We've not had us talking about deaths, but now we are beginning to see the loss of life. And I will share with you the statistics of those people who are today in hospital, depending on oxygen, those who are in ICU, and those that are admitted in wards. And this becomes increasingly concerning for us. But before I get there, allow me to take this opportunity to commend in a very special way the Nairobi County, the NMS, for the very good progress so far in the vaccination program. You're one of the few counties, actually, the second county in the nation, where at least 50% of all adults above 18 years old have been fully vaccinated. And again, it's the second highest coverage, as I said, in the country. And I congratulate the leadership of NMS, and particularly the one driven, the health sector, led by you, Dr. Oluga, for what you have done. And you have already recognized, very rightly, that Nairobi has the largest population of adults and indeed the highest burden of COVID-19 disease. And Nairobi constituting 41% of all the reported cases in Kenya. So you can imagine if we had less people vaccinated, we would certainly be seeing more deaths, more people hospitalized. And it's my really humble opportunity to request those, the 20% of you who are still out there of the adult population in Nairobi County who have not received a single dose, to come out and get that vaccine. I must point out that the government is indeed concerned of those people that I'm talking about out there, the ones that remain unvaccinated. And those are 1 in every 2 people. So out of every 2 of us, 1 of us is not vaccinated. And it is these unvaccinated people who not only risk their own lives, but also they put at risk the lives of those that are vulnerable around them. We must therefore seek out the remaining unvaccinated population even more aggressively than before through collaboration with all stakeholders. And I do recognize the challenge that communities face in accessing services, and that has been said here before. And this is why I want to really, in a special way, appreciate this collaboration between AMREF and AstraZeneca with the government of Kenya to set up mobile clinics that will bring these vaccination exercises closer to the people so that we cannot have an excuse. And mine is to urge that as the clinics move within our communities, just take that one step to leave your house, to leave your small business for just 5 minutes and get yourself protected. These clinics, we know, will increase the number of service points across the country and also be a very good platform for us to disseminate not just the COVID issues, but health information on the risk factors for non-communicable diseases, which, as told you earlier, account for 40% of deaths, and in the process promote health behavior amongst our community. I want to urge all those people that have not been vaccinated to make use of this opportunity, really, and get vaccinated at the nearest health facility or when that mobile clinic comes near you. What more can we do as government? We are doing everything. All you need to do is just take a step to get the vaccination. Those who are fully vaccinated are also urged, as we have said repeatedly, to get their booster shots 6 months after their last jab. And I urge the public to take note of the practices that can lead to the development of non-communicable diseases, because we will not leave that discussion behind even as we discuss COVID, and that includes issues of smoking, excess intake of alcohol, physical inactivity, we keep urging us to be more active, and healthy food intake. And we all really must ensure that we avoid risky behaviors so that we can reduce the likelihood of getting some of the diseases that we have talked about. And I must also include here HIV and AIDS, which make us all much more vulnerable in these difficult times of COVID-19. The Ministry of Health is targeting to vaccinate all adults by December 2022. We are now almost in the middle of the year, so we have a journey to go. And we note that our target also for teenagers is to have at least 50% vaccinated. And I want to urge every county to develop innovative solutions, such as the one we are seeing here together, and any other that really carries the local context in order for us to accelerate the vaccination rates in view of the high positivity that we are seeing, which is now standing